Well, first of all, we had to change the way we worked as radiologists. So before our group, we would switch seats every half day to a different seat to sort of spice it up a little bit. And so we changed that pretty quickly to no, you're there for the whole day. So you'd walk up in the morning and sanitize your whole station and get started. And then from a patient perspective, there was a lot more questions required of, does the patient have any risk factors for COVID? And so that started with our front desk staff, calls the day before or the weeks before. Okay, you can't come if you have these symptoms. And so there's a lot more missed appointments and canceled appointments. And then once the patient's there, we label them either COVID suspect or COVID non-suspect. And then that would sort of split in the road into how we interacted with them, what PPE we had to wear. And that's all evolved over time. It was pretty strict at the beginning, and then as we sort of have learned more about the virus, we're maybe using less PPE or some of the more stringent PPE, and that's partly to help not overuse some of the equipment we have if it's not necessary, and if there's good evidence that it's not needed. And so we've also started mock codes in our department and all over the hospital to help deal with, because most of us as healthcare givers know the ins and outs of CPR and ACLS, but maybe not in the context of a medical procedure in the setting of CPR and chest compressions. And so how to deal with that. And okay, well, one group has to go out and gown up and get their PPE on because we may be intubating this patient, and then the other group has to stay with wow, just do chest compressions, nothing to do with the airway, and then switch it up. And so it sort of has insinuated itself into daily life. Every little facet of what we did was affected.